Hi, I'm Dr. Kyle Schunkweiler, the founder and one of the doctors here at Spine and Sports Chiropractic. If you're watching this video, you or someone you care about may be suffering from hip pain. Now, with hip pain, you can get hip pain either on the front of your hip or on the back of your hip. So let's take just a moment to look at what some of those causes might be. So, front of the hip pain most commonly comes from having an injury to this thing right here. This is the anterior joint capsule. So it's actually the ligament that holds the ball inside the socket joint. Another thing you can get if you have an arthritic hip, it hurts a lot when you cross your leg in front of you, and that'll give you a lot of groin pain here in the front as well. If you're unfortunate enough to get a hernia, it's where part of your abdominal muscles, they widen a little bit, and then the intestine starts to poke through. That'll also give you pain here. Or maybe you just kind of misstepped or did a lot of crunches or sit-ups and you might have strained one of the big ligaments or some of the muscles that are here on the front. So those are a lot of the things that we see in our office all the time. So let's dive into one of those specific injuries and look at it really closely on how we would figure out if that's exactly what you have. So let's look at the anatomy of the front of the hip and kind of give you a better idea of what might be causing your pain here on the front. So I'm going to use my Visible Body app, and if I zoom in here, let's take a look. So I'm going to start taking away muscles. So I'm going to start taking away all your abdominal muscles. It's kind of like having kids and getting married, right? They just go away after time. So the hip flexor group gets talked about all the time. People say, oh, you get low back pain from your hip flexors. The hip flexors are often a cause of pain on the front of your hip. So I'm going to remove your sartorius muscle here. So right here are your hip flexors. And if you see those three gigantic muscles, just like my bicep is an elbow flexor, those three muscles are my hip flexors. So, and they travel underneath, you see that white little ligament that's right there? So I'll spin him up and see how those tissues live right underneath that ligament. So if you kind of slip and fall, like if you're running out in the rain or you're outside and your leg falls back, you're probably going to stretch that big ligament and have pain on the front here. And we also talked about the hernia stuff that could happen, but those muscles, they get overused all the time if you do prolonged sitting, tons of sit-ups and crunches. My runners get them. If you're not very good at pushing through your hips and more of just doing like a pulling while you run, you're going to overuse those. And then if I take all your muscles away, there's the front of the hip and there's that hip capsule that we talked about. So if that shortens up or tightens, because when you sit, like if you look at me right here, my pants are nice and straight, but as I were to sit all day, you can see my pants wrinkle up, just like how you would wrinkle up the front of your hip capsule. Well, if I have a ball and socket joint and it's supposed to spin in there really well, and I tighten up the front of the capsule, now I've displaced the ball and now it doesn't want to spin very well. So all of these are reasons of why, like kind of the mechanism of how you would get pain on the front of your hip. And here at Spine and Sports Chiropractic, we specialize in determining and diagnosing which one of those injuries you may have, and then also the soft tissue treatment that goes with it. I know we're chiropractors, but we probably spend 99% of our day just treating soft tissue and the muscles, because typically it's the soft tissue or muscles that cause the joint problems. So if you or someone you know is suffering with pain on the front of your hip, Spine and Sports Chiropractic is a good place to start. We're only one phone call away.